Hello and welcome to Transforming Healthcare, People Behind the Progress, a series from HSE, Technology and Transformation. My name is Joyce Shaw, Chief of Staff, and today I'm joined by Sara Long, Regional Executive Officer for HSE Dublin and North East. Sara brings a strong track record in transformation, having previously led the Education Authority in Northern Ireland, and she has also extensive health and social care experience across performance improvement and commissioning. Sara, thank you so much for joining us. To start, maybe you give us a quick overview of your career journey. What shaped your approach to transformation before stepping into your REO role?
I began my career as a general management trainee in the NHS. There was only 3 of us in Northern Ireland, and we joined forces with the Welsh trainees to do our academic component. And I think right from the outset that was very helpful in terms of sharing learning, sharing experiences, and working through problems together. I worked in a community trust in Northern Ireland, and I worked in an acute trust in Northern Ireland. And then in 2007, we brought the acute and community trusts together, and I worked in what then became the Western Trust in a range of roles right across services. So I've encountered both community services and acute services and the challenges that they bring, and in bringing them together and trying to integrate those services as well. I had a short spell in commissioning in Northern Ireland in the Health and Social Care Board, where I was the Cancer Commissioning Lead. And again, that required close collaboration, working across trust, working across boundaries and bringing services together. And then in 2016, I joined the Education Authority. I decided I had transferable skills and off I went to education, where we were bringing together 5 legacy education and library boards into one new organisation called the Education Authority. So again, that was about bringing organisations together, bringing cultures together, collaboration and working together. I was their Director of Operations and Estates for 3 years, and then in 2019, I became their Chief Executive, and I was their Chief Executive at the Education Authority for 5 years before coming here to Dublin and North East to become the REO.
Sara, for anyone who may not be familiar, what does the Regional Executive Officer role involve, maybe day to day, and what are you most focused on right now?
As Regional Executive Officer, it's my responsibility to run the region of Dublin and the North East. And I do that with my IHA managers, my Integrated Healthcare Area Managers of Cavan Monaghan, North County Dublin, Dublin North City and West, and Louth Meath. And the idea behind the creation of those areas was that we would deliver care in an integrated fashion and as close to patients and service users as we can. And that's really our focus at the moment. It's delivering integration, and it's delivering a population-based care approach and a population-based planning approach. Alongside that, here in Dublin North East, we're also very excited about the opening of our new surgical hub, which will come on stream later this year. Planning for our elective hospital, which will be built on the Connolly site, and also the implementation of the electronic healthcare record, which will be transformative and will be a large priority for us in Dublin and North East, as we are the first to implement the electronic healthcare record.
Sara, what are the biggest opportunities you see for digital for care?
So I think there are big opportunities for us as a region, and there are big opportunities for us as a country with digital for care. I think the electronic healthcare record has huge potential, first and foremost for patients and for patient safety. So it will reduce error rates, it will ensure that information is accurate and up to date, and it will help clinicians make the right decisions for care. I think it will also empower patients and service users and the population in terms of access to their own data easily and readily, and it will avoid duplication in that regard as well, in that they can answer questions once and once only, and they will have access to that. I think we can't ignore the productivity and efficiency gains that there are to be had through digital for care and through the electronic healthcare record. Again, avoiding duplication, reducing burdens of admin, and really maximising the potential that there is through the use of AI and other tools as well. And then I think from a population perspective and a population planning perspective, and back to Sláinte Care, I think the data that we will be able to capture and to collect on our population to help us better plan for their health and care needs will be phenomenal. It will be absolutely transformational in that space, and hopefully that will help us with the delivery of sláinte care.
So collaboration is a huge part of making change stick. How do you bring clinical, operational and digital teams together so that transformation is truly joined up?
So I think collaboration is key, and relationships are key in any change and transformation programme. And I think the way to do that is to make sure that that is how we work. That is how we do our business. And if that is how we do our business day to day as a collective, collaborative team, then that is how we will approach our transformation programmes and projects as well. And then that won't be unfamiliar to people, and those relationships will be there. So here in Dublin North East, we really do pride ourselves that we work as a team, that we work collectively and we work collaboratively, and that all the members of the executive management team work together to achieve the best outcomes for the population of Dublin and North East.
Sara, what have you found works best to build confidence and engagement with digital change among staff, particularly where there's maybe change fatigue or pressure on services?
So I think the key thing there is to focus on the benefit and to focus on the outcome. It's not digitisation for the sake. It is, as we talked earlier, about all of the benefits and the impact that can have on the patient and the service user. So I think if you focus on those benefits and you highlight those benefits, that will really help to motivate staff around the changes that you're trying to make. I think it's also important to say that we don't just want to digitise things as they currently are. We want to look at the workflows, we want to take the opportunities there, and we want to take the opportunities where we can to improve and enhance our pathways of care. And staff and teams will always come in behind that. And certainly we've got the learning now on the electronic healthcare record from our colleagues in the North, and also we've spoken with our colleagues in Canada. And I think there is enthusiasm for the benefits is what they really pushed with us. They really did push that transformational nature of the change that we are making and the enthusiasm that can be built around it, because it really will transform healthcare, not just digitise it, but transform it. And certainly that was very clear to us from our conversations with our colleagues who have gone before us.
Looking forward 2 to 3 years, maybe, what are you most excited about in terms of digital transformation across the HSE? What needs to happen now to enable that future?
So 2 to 3 years from now, Dublin and the North East will be right in the throes of implementing the electronic healthcare record, we hope. And so that's very exciting. It's a very exciting time for healthcare in Ireland in that regard. It's also a little bit daunting. So, you know, there's a big programme of work to be done there and a big change programme to be facilitated. So with equal excitement and fear, I think we look forward into the next 2 to 3 years. And I think we'll get learning from Dublin North East as well. So we've talked earlier about how we learned from our colleagues who went before, but certainly the implementation in Dublin North East will bring its own learning. And when we did meet with our colleagues in Belfast, they did talk about the concept of paying forward and paying backwards. And certainly that's how the trusts in the North approached it, in that those who went first then paid backward, if you like, in terms of their learning, and those who came before paid forward, in that they were very involved in the design and the implementation right from the outset, including not in their region. So I was very taken with that concept of paying forward and paying backwards. So I think 2 to 3 years from now, we'll be paying forward, and I'm hoping that we will be right in the throes of our implementation.
Finally, Sara, what message would you like to share with the teams across Dublin and North East and even across the wider HSE who are contributing to Digital for Care and improving now how care is delivered every day?
So I think my message is that this is an exciting time, that there is an awful lot of opportunity here, and I would encourage all of the teams to get involved, to become interested, to become motivated, and to get involved and really drive forward this agenda, because I think we have a once in a generational chance now with the electronic health record to transform healthcare. And I would encourage all teams and all staff to see that as a key priority for them and to get involved.
Sara, thank you. That was a really helpful perspective on leading change through collaboration and on how Digital for Care can support safer, more connected and more efficient care across the HSE. Thanks for watching, everyone. To keep up to date on the people and programmes driving Digital for Care across the HSE, Follow us on all our social platforms at HSE Technology and Transformation.